People living with dementia often want to be involved in decisions about how technology is used to support their care at home, but there are no tools to help them and their care partners understand technology options or to guide them in balancing a desire for monitoring safety with a person living with dementia's dignity and wishes. There are many reasons families require support to make technology use decisions. First, technology use preferences are diverse and relationally embedded, and that diversity requires individualized, person-centered approaches. Second, ethical use requires that people living with dementia be involved in decision-making to the extent possible. Decision-making involvement recognizes their personhood. Third, the use of technologies that collect data like visual and activity, location, or even audio may contribute to stress or conflict due to their surveilling nature. My research and others have found that we should actually expect family care partners and older adults to have divergent preferences for if and how to use various technologies. Care partners can experience stress from having to make care decisions when they don't know or they don't agree with a person living with dementia's preferences. Our project is to learn how to provide empowering decision support for caregivers and people living with dementia as they contemplate if and how to adopt various technological tools that are designed to support their safety, health, or well-being. Let's Talk Tech is the first of its kind education and communication tool that helps families meaningfully engage people living with mild dementia in immediate decision-making and planning for technology use. It offers a comprehensive assessment of 4 categories of technologies that collect diverse types of data. All content is research-based. The self-administered intervention is delivered as a web app and takes about 45 minutes for at least 2 people to sit down together and complete. It's grounded in the theory of dyadic illness management that posits that care dyads with shared appraisals and more collaborative illness management, like shared decision-making and communication and care planning, will have better health outcomes. Let's Talk Tech's purpose is to facilitate dyadic education, communication, and documentation of the person living with dementia's preferences for technology use and other options. When we embarked on our pilot study with 29 dyads with people living with mild Alzheimer's disease, there were a lot of unknowns because this is the first of its kind tool, including what if it actually provoked conflict to have these difficult conversations. We learned from our pilot participants that they felt that any discomfort they experienced was well worth what they gained from completing Let's Talk Tech and having these conversations. The pilot yielded very positive feasibility and preliminary efficacy findings. There were statistically significant improvements in care partners' feelings of preparedness to make technology decisions, in their demonstrated knowledge of their partner's preferences, and feeling of mutual understanding. There were also statistically significant improvements in post-test and care partners' understanding of each of the feature technologies and promising improvements in understanding of most of the technologies by the participants living with mild AD. We were pleasantly surprised by the 100% completion rate of all parts of Let's Talk Tech by the dyads. This is something we didn't anticipate with a self-administered tool. Dyads told us they found that the information was presented in a balanced, unbiased way, neither pushing nor discouraging use of any given technology, appreciating that this intervention comes from academic research. They also gave us important feedback that will help us enhance its reach and relevance. Care partners noted that by documenting the person living with dementia's preferences, it had the potential to smooth out possible conflict in decision-making when there's more than one care partner involved in these decisions. They discussed wanting to share this information with adult children, with other family members, with professional care providers, and even with future long-term care residences. Let's Talk Tech documents the person living with dementia's preferences for tech use for them to access at any point for the dyad, but our first version of Let's Talk Tech didn't enable easy sharing of the conversation that dyad members had with people beyond the dyad. What if we could enable dyads to share the summary of their technology preferences with others? There are well-established barriers to preferred tech use among older adults beyond technology education and dyadic communication that were echoed by our pilot participants. They asked questions after they completed Let's Talk Tech, like, how do I find the device we decided would be appropriate? How do I install it? And how do I get help using it? If we could activate their larger care networks, family and friends, social workers, care coordinators, nurses, or physicians, Let's Talk Tech preferences could serve as a bridge to communicate these needs to people who may be well positioned to help the dyad with those technology needs. Sharing those preferences with family members and providers could activate their larger care network to support the dyad to use technology how they want to. And this is what we're excited to be doing with the Penn AI Tech Pilot Award. We will implement patient-controlled, standards-based, secure sharing of preferences using the FHIR-based Smart Health Links protocol to share verifiable clinical information so they can easily share their preference summaries with anyone they want to. We will employ standards to promote interoperable sharing of documented preferences and assess clinician acceptability of viewing these preferences in a test instance of the EHR. We're also adding 4 features indicated by the original pilot study exit interviews. For example, one of them is to make it more widely accessible. We will make sure Let's Talk Tech is fully optimized for small phone screens. And then based on learning from the provider survey, the clinician survey, and dyad user testing of the new features, we will iteratively improve the tool and incorporate these findings. The interdisciplinary team doing this work is at the University of Washington School of Social Work in partnership with the Clinical Informatics Research Group in the School of Nursing led by co-I Bill Lober. And the University of Washington Alzheimer's Disease Research Center is enabling us to recruit dyads to conduct this pilot. Please contact me, Clara Berridge, if you have any questions. Thanks for your attention.